human metapneumovirus, an emerging health concern in China. Today, we turn our focus to an unfolding health situation in China that has drawn increasing global attention: the recent surge in cases of human metapneumovirus, HMPV. This respiratory virus, which has been known to scientists since its discovery in 2001, has quietly circulated for decades. However, it has now taken center stage as hospitals across China grapple with a sharp rise in respiratory illnesses, particularly among vulnerable populations. Let's delve into what HMPV is, why it's causing concern in China, and how the government and healthcare systems are responding to this challenge. What is human metapneumovirus? Human metapneumovirus, or HMPV, is a respiratory virus belonging to the Pneumoviridae family. It shares similarities with other viruses such as respiratory syncytial virus, RSV, and influenza. While it is not a novel virus, HMPV is gaining attention because of its ability to cause respiratory illnesses that range from mild colds to severe conditions like bronchitis and pneumonia. The virus primarily affects the respiratory system, presenting symptoms like a runny or congested nose, coughing, and fatigue. In more severe cases, it can lead to breathing difficulties and even hospitalization. Vulnerable groups, such as young children, the elderly, and those with weakened immune systems, are particularly at risk. What makes HMPV especially challenging is its ability to mimic other respiratory illnesses. For example, it is often mistaken for the flu or RSV, making accurate diagnosis essential, but not always immediate. The situation in China. Over the past few weeks, hospitals across China have reported a dramatic increase in respiratory infections, with a significant proportion attributed to HMPV. Pediatric hospitals in major cities, including Beijing, Shanghai, and Guangzhou, have been overwhelmed by the surge. Parents are queuing for hours in overcrowded waiting rooms as healthcare systems struggle to keep up with the demand. Reports suggest that some hospitals are experiencing a 40 to 50% rise in respiratory cases compared to the same period last year. While HMPV is not the only virus contributing to this trend, it is emerging as a significant driver of the current health crisis. The timing of this surge is critical. Winter is the peak season for respiratory illnesses, as colder temperatures and indoor gatherings create ideal conditions for the spread of viruses. In addition, China's densely populated urban centers make it difficult to prevent the rapid transmission of airborne illnesses like HMPV. Symptoms and transmission. HMPV symptoms are similar to those of other respiratory viruses, which complicates its identification. Common symptoms include runny or congested nose, persistent coughing, sore throat, fatigue, shortness of breath, fever. In severe cases, particularly among high-risk groups, the virus can lead to complications such as bronchitis, pneumonia, and acute respiratory distress. These severe cases often require hospitalization and, in some instances, advanced medical interventions like oxygen therapy or mechanical ventilation. The virus spreads through respiratory droplets when an infected person coughs or sneezes. It can also be transmitted via contaminated surfaces or close contact with an infected individual. These modes of transmission make HMPV particularly difficult to control in crowded environments, such as schools, workplaces, and public transportation. The government's response. China's health authorities have moved swiftly to address the outbreak. The National Health Commission has issued guidelines to healthcare providers for identifying and managing HMPV cases. Increased testing capacity has been deployed to confirm diagnoses, while hospitals have been instructed to prioritize care for high-risk patients. Public health campaigns have also been launched to educate citizens about the symptoms of HMPV and preventive measures they can take. These measures include regular hand washing with soap and water, wearing masks in crowded or poorly ventilated areas, avoiding close contact with individuals showing symptoms of respiratory illness, staying home when feeling unwell. Despite these efforts, the rapid increase in cases has placed immense pressure on healthcare systems. Hospitals in major cities have reported shortages of beds, oxygen supplies, and medical staff, particularly in pediatric and intensive care units. Comparisons to COVID-19. The rise in HMPV cases has drawn inevitable comparisons to the early days of the COVID-19 pandemic. Both viruses affect the respiratory system and can cause severe symptoms in high-risk groups. However, there are key differences that set HMPV apart. Contagion levels. HMPV is not as contagious as COVID-19, with a significantly lower reproductive number. Mortality rates. The mortality rate for HMPV is far lower than COVID-19 during its peak. Medical knowledge. Diagnostic tools and treatments for HMPV are already established, unlike the uncertainty seen during the early stages of COVID-19. Public health impact. HMPV has not necessitated drastic measures like lockdowns or travel restrictions. These distinctions mean that while HMPV poses a significant challenge, it is unlikely to lead to the same level of global disruption as COVID-19. The role of surveillance and data transparency. One challenge in addressing the HMPV outbreak in China is the lack of centralized and transparent data. While anecdotal reports suggest a rise in severe cases and some fatalities, official figures remain scarce. This lack of transparency makes it difficult to assess the full scope of the outbreak and coordinate an effective response. Global health organizations, including the World Health Organization, have urged China to share more detailed data on HMPV cases and deaths. Improved surveillance and reporting are essential for understanding how the virus is spreading and who is most at risk. High-risk groups. As with many respiratory viruses, certain populations are more vulnerable to severe illness from HMPV. These include young children. Their developing immune systems make them particularly susceptible. Elderly individuals. Age-related declines in immune function increase their risk. Immunocompromised individuals. Those with weakened immune systems, such as cancer patients or organ transplant recipients, face a higher likelihood of severe outcomes. People with chronic illnesses. Conditions like asthma, chronic obstructive pulmonary disease, COPD, and heart disease can exacerbate the effects of HMPV. The global perspective. While the current HMPV surge is centered in China, respiratory viruses know no borders. Experts warn that similar outbreaks could occur in other countries, particularly in regions with cold winters. This underscores the importance of international cooperation in monitoring and responding to emerging health threats. Governments worldwide are closely watching China's response to the HMPV outbreak. Lessons learned from this situation could inform strategies for managing future respiratory virus outbreaks, including the development of vaccines and antiviral treatments. Conclusion. The rise in human metapneumovirus cases in China is a reminder of the ongoing challenges posed by respiratory viruses. While HMPV is not as severe or widespread as COVID-19, it highlights the need for vigilance, preparedness, and public awareness. For now, the focus remains on managing the current surge, protecting vulnerable populations, and strengthening healthcare systems to prevent similar crises in the future. As the situation develops, we will continue to bring you updates and insights into this emerging health concern. Thanks for watching. Like, subscribe, and share your thoughts in the comments.